Hello there everyone and welcome to another live session here with Dr. John Butler, and today we are talking all about anxiety, possible causes and things which John has found helpful with 40 years of experience in the field of psychology and hypnotherapy. Hello Axel. So John, if you can again briefly give the introduction about yourself, about the school HTI, and also then if you can talk a little bit about anxiety, how you would define anxiety, how would somebody know whether they're anxious or is it just a normal feeling. And then of course anxiety is a normal feeling, but when anxiety may actually come in your way rather than in supporting you to fulfill a better life. If you can cover those, and then I'm going to ask you some questions which we already got in from the audience throughout the week when we published this event and as things are taking place. So John, the stage is yours.
Thank you, Aidan. I'm John Butler, Director of Hypnotherapy Training International, and as Aidan has been saying, I've been practicing hypnotherapy for almost 40 years. I've been teaching for almost 30 years. HTI has schools around the world and that we liaise with. We are either very much there on a more regular basis or intermittent basis, and we teach our students how to become effective hypnotherapists. Today's topic is on anxiety, and I haven't heard of the questions yet, so I'm looking forward to answering your questions and making this as interactive as possible. Anxiety as a condition in medicine is often thought of as a very broad condition, encompassing phobias, panic attacks, and in the past lumped under that heading was post-traumatic stress disorder, obsessional compulsive disorder. Nowadays those two latter ones have been taken out of the classification, but really all kinds of fears come under the heading of anxiety. And they can be very specific, phobically attached to some object or situation. And hypnotherapy, of course, is the tool that we use, the broad approach that we use to helping people understand the problem and take control back. And the really great news is that anxiety can be conquered, and usually very quickly. People who are chronically anxious for a long time, now some of them may take a bit longer to work through the issues with them, but in general it's safe to say that they can get control and be helped a great deal. Now the word itself, anxious and anxiety and so on, those terms have been around a long time, and they have for a lot of people become attached to a kind of a medical labeling, and we're not that interested in that at the moment here. Classifications and labelings have their place, and that may involve medication, and in the worst case of anxiety, psychiatric help. People need to be in consultation with their doctors if they have such a degree of a problem, and those are some of those more difficult cases I talked about. But most cases of anxiety that we see in everyday hypnotherapy practice are really helped greatly, because it is a question of people's irrational fears, subconscious fears, that really have no basis in reality. They're either highly exaggerated or totally irrational. So the goal of the therapy is to help them face those, push through them, and get to a point of dissolving them. Perhaps at first they have to learn to manage them, to cope in spite of those fears, but then gradually break them down and get rid of them. Now some people, as I was saying, have longer term issues, and there may be people who have biochemical issues, and we could talk a long time, or I could talk quite a while at least, about the areas of the brain involved, the amygdala, basal ganglia, and some of the biochemical factors involved, including genetic factors. Some people are born more anxious and some are much more relaxed. Again, we don't need to go into all that at the moment, but it's important to know that those exist, and for some cases a hypnotherapist may well have to refer them on for additional help. But in the meantime, working with the majority of cases, it's important for them to understand that their subconscious mind is the mind that is creating most of the problem. And what are we calling the subconscious mind under that label? What is it? It's the mind of non-logic, the mind of imagination, the mind of emotion, and that's where the problems are stuck. The feeling mind has produced a fearful reaction. It's attached itself to some situation, and it may be a very generalized anxiety in some case. That's generalized anxiety disorder, where they project fears onto many things in life. And as soon as they conquer one area, one fear, perhaps it'll spread to another area. That's been known to happen because it's within that individual. They have a conflict. They are maybe in some cases just don't trust their own judgment. They don't believe in themselves enough. So they feel anxious, weak, fearful in general, apprehensive, worried about the future. And we all have to face reality, and reality is on the physical level, it's emotional and so on. On the more physical level, we have fear of illness, fear of death and aging, fear of poverty, not having control of your financial affairs. And that feeling of not control is what often contributes the most central part in the anxiety. You can go to a horror movie to be frightened, but at the end of the day, we know we have control. So we teach people to take back control from that situation, to stop projecting onto it, because really that's what they're doing at a subconscious level. And it's important to know that they have that power, that they have a choice, that there's a choice to frighten yourself about anything, or to take away the power from the fear so it doesn't continue to steal your life, steal your energy. And that, of course, requires help. And that's why people need to learn about their subconscious mind. They need to come on a training course with us or a competent school where they will learn about their subconscious power. And instead of being working against them, that subconscious power can be used for the other polarity of the energy, the opposite of fear being courage, bravery, or confidence at least. So they can begin to tap into that other polarity of energy, of the same energy of fear that's within them. So we all have apprehension maybe in performing a very complex task, a very difficult task. And we often talk about performance anxiety, anticipatory anxiety, which of course when you understand in hypnotherapy how to take control over your subconscious, then that becomes a positive energy. Instead of nervousness, it's excitement. We'll say instead of being anxious about the object or the event, I'm actually anxious to get on with it, to succeed. You see, the word itself tells us that there's a certain energy in there behind it, as there is behind everything, and it's how you use the energy. And the person with anxiety often isn't aware of how they're misunderstanding the challenge, the challenge to their finances, and how to take the power and to use the energy creatively, how to face those fears of everyday life, of not maybe having success, fear of success, a fear of failure, fear I'll never find a good love relationship, fear I won't achieve a certain goal. So we human beings have many kinds of fears, and we need to look into that sometimes in more depth. Sometimes simple programming will do the job, teaching them and giving them good programming suggestions and how to program themselves, which takes them a lot further than basic cognitive methods. CBT, which has its place, but it's only a small part of hypnotherapy. Hypnotherapy goes far beyond that. How to creatively use the imagination. So instead of terrifying ourselves with these imaginary fears, because they're not based in this case on a realistic appraisal of the situation, and we can't justify them as being really objective reality. In that sense, they're illusions, they're distortions. We can penetrate through that and begin to see it clearly, see the challenge, and begin to program our minds for success, for overcoming that challenge. Now, boosting people's confidence long term could be a part of the therapy, not just eradicating the specific fear or phobia with them in their minds, because often that's just a simple thing. Many phobias disappear in one session of hypnotherapy. Sometimes they take a bit longer. But when the anxiety is more deeply rooted within the personality, maybe from early childhood experiences, they've had bad treatments, they lack confidence in themselves. They need help to overcome those long-term effects. And we will take them into the therapy, clear out that baggage from their past so that they can begin to find those resources which are within them, which are being obscured by the fears. In other words, every frightened person has a great deal of courage, but it's masked, it's hidden under the fears because they just constantly connect with their fears and never release their own confidence, their own courage. So a fear may sometimes have a deeper meaning. Again, we can penetrate into that with the hypnosis, opening up the subconscious. So all of this requires, to do the job properly, not superficially, requires you to have good knowledge from a good training school and a good therapist if you're a client attending that therapist who can take you through the fear, who can take you through it as quick as possible so you're not becoming dependent in therapy and you're learning to use your own imagination, your own creative power for your benefit. And frankly, our fears make traitors of us all, as they say. And if you face your fears properly and what's behind them and build your courage, your confidence, well then you achieve a totally different quality of life. Because most people, their fears are holding them back tremendously in life from what they could achieve. So I hope you'll look further into this topic with us by coming on one of our courses. And I've only scratched the surface. I haven't even talked in depth about the many tools of relaxation and programming and visualization and the other tools we have for going deeper into a very specific, deeply rooted fears a person may have, because we have all of these and they're there for you to learn about as a trainee therapist. And if finding a good therapist who's trained with us, they will help you to understand your fears as a client, for you to penetrate through those illusions and break through out of that to the other side and find your true courage and your true strength and have a very, very different quality of life.
So first of all, John, thank you so much for that. Before we go away, we have some questions here, and then also if you can cover about the course. I can see I have some printed leaflets here. So first of all, we go to your Axel Sogstad, and he's saying, "Hey John, as you may know, I have specialized in working with people who suffer from IBS. Some of these also suffer from severe anxiety. At times, I seem to experience transference. Any advice would be appreciated." So John, if you can answer that to Axel, any suggestions, tips, that would be great.
Well, now that, Axel, you've mentioned that point about the IBS, of course, as I said earlier, we haven't gone into all the different expressions and symptoms of anxiety because there are many physical effects of anxiety that often manifest as psychosomatic illness over time. And irritable bowel often is associated with severe anxiety, which often goes with depression and stress reactions. Again, these are complex things to go into. We wouldn't have time here. But now that you're working with people with IBS, and you get countertransference, now there's issues that they have to face and they need to, of course, make that separation. A countertransference is just a projection onto you of baggage within them. And they have to be able to move beyond that situation of essentially putting you into a negative authority role within their mind. Now, that happens. Every therapist working with clients fits into the subconscious mind of the client in different ways. For example, you can be at times the good father that they never had, that they wish they'd hoped, and so they're projecting that onto you. At other times they're seeing you as the abusive father, the one they actually had. Now they must work through their father issues, which are, of course, their responsibility. And you're there as a therapist to help them, give them the power to do that. As we say, become your own parent. And so the client must then separate from the past and live in the present, and must, of course, begin to forgive the father, which is easy to say sometimes, but not so easy to do. And that may be quite a longer process, at least a stage of acceptance of the father, so that internalized father can be the power taken away from that internalized father through forgiveness, and the client begins to then come to terms. with their father and the feelings they have within themselves that are conflicted, so then they won't be projecting onto you. Now, I'm just using the father issue as one of the many challenges people have in their lives to deal with. But clients, and the danger of long-term therapy is that therapists can get stuck within the client's mind in a transferential relationship of transference, counter-transference, and counter-transference, which is all best resolved through hypnotherapy, because you short-circuit the therapy, give them the power, you teach them self-hypnosis effectively so that they become their own parents and move out of that kind of transference. But it's easier to say than do in some cases, so the client has to be helped to feel strong enough to be able to forgive, to be able to move on. And so sometimes if you have a very difficult client, you may need to talk to your supervisor in some depth about this and see what's going on with that client and why and how they're stuck. And maybe there's an element within them that doesn't want to let go, that wants the alibi of the past, they want to stay in a victim role. And as therapists, we have to motivate them to change, help them get ready for change. And that always involves several factors, which I think are really a subject for another discussion. How to motivate change, which involves carrot and stick and looking at their values, beliefs about themselves, and a structured therapy over several sessions to help them now make the decision to change. Because many clients actually, even though they come for therapy, are not really at that point of readiness for change. They're on a stage of getting ready to be ready to change. And then if you work effectively with them, often that's very quick. It may just take a session or two for them to really decide, right, I've been in therapy for 20 years, I'm here with a hypnotist, I'm now ready to make some serious change. They're feeling the strength and confidence, they're learning their self-hypnosis, and they need now to move on from the child role, and they're feeling ready to do that. So this is what we often see happen in therapy. They'll tell you, I've been in therapy for 10, 15, 20 or more years, but now I start to make the changes that I've been feeling unable to make, that I've been avoiding.
Thank you so much for answering that question in such great depth and details, and also leading for more information for Axel there. So he appreciate that. One question from me personally is that with anxiety, it can be such a big part of a client life, is that they are even anxious about seeing a hypnotist because they're thinking, oh my God, what will happen when he regrets me or hypnotize me? Any tips on that? They are so anxious to close their eyes next to their therapist. Can you help us a little bit with that? What kind of things would you say to a very anxious client that is afraid to close their eyes, let alone to be regressed or to start opening up things?
Well, that all requires the therapeutic relationship being developed. It's a sense of trust that you're not judging them, and so that whatever comes out of their subconscious mind, when they open their emotions, they're feeling safe to reveal. And of course, that's something you learn as a good therapist in a good training school. You learn the qualities of an effective therapist, how to build a therapeutic relationship, which is the heart and soul and foundation that allows you to use your tools and methods and strategies. And so that takes a bit of time to learn as well, develop those therapeutic qualities. But when clients find that they can respond to a hypnotherapist, you take them gently through relaxation exercises, suggestibility tests, responsiveness testing, and find they're responding. Now they begin to trust the process, begin to feel a sense of safety as well with you, that you're not doing anything very weird, that you're not taking over their minds, which is a great fear with hypnosis that still exists out with some people. So it's leading them gently into it with a benign, positive personality of the therapist that allows them to begin to reveal. Now, of course, that will happen very quickly with some people. Others will take a bit longer. So getting them to open and close their eyes several times with suggestibility testing of the eye catalepsy so they know they have control. For example, that might take away most of that fear straight off. On the other hand, if the fear is I'll reveal my secrets, I'll be exposed, and that's a fear we most people have. It's a fear of revelation. It's a fear essentially that they're not quite good enough, that they're not lovable, which is a topic I was going to just make sure to touch before we finish today, that the biggest fear of all, and we see it expressed in things like, in situations like fear of public speaking, fear of rejection, fear of being criticized, the fear really that we're not lovable, not good enough. And so you may be facing that fear with the client who's having trouble trusting you and going into a trance. The trance represents a contract that's being accepted now with the client, that I will do what you ask me to do because I trust you. And so it's an unspoken contract, of course, and it can only be achieved with the right kind of personality within the therapist and motivating the client in the right way. So it'll take a bit longer with some than others.
Thank you for that. Another thing that comes to mind is that there are many people, therapists, who claim that overcoming phobias is very easy, one session and it's done, and they would even go as far as said guaranteed. What do you say about this?
Well, guarantee is never acceptable in therapy because we can't guarantee anything. However, we can look at the results that we've had as good therapists, and the best therapists never exaggerate their claims. They stand on their own work, and they know, of course, that many phobias dissipate on one session. That doesn't mean they've always gone completely, that they may not come back again. There is a potential for relapse with anxiety and with phobias, but for good therapy, when therapy's done well, it's rare. So we have to be very careful when claims are being made. And it's best for statements to be made in a measured, controlled way, to be appropriately positive, that we can say, as I said at the beginning, most cases of anxiety will respond very, very well to therapy, and some will just take longer than others. I often say 1 to 4 sessions, and that's to allow for things that may come up. There may be things behind that phobia. A phobia may not always be exactly what it seems on the surface. The majority of them don't have very deep roots, even though they're very powerful sometimes. And they did dissipate in one session. Many therapists, hypnotherapists mostly, will find that phobias disappear in one session. And put simply, we can say, well, so what? That was all there was to it. It didn't have any deeper connections within the person's minds, and occasionally some phobias will. And they have to be tackled at a different, deeper level than just simple programming.
Perfect. Thank you so much for answering that. That question was very important for me to ask, for the obvious reasons you just covered. So thank you for that. As I said earlier in that live session, you've got some leaflets on your desk here. If you can grab them and just if you can tell us a little bit about them. I know they're about the courses you have. So if you don't mind, I'll start by the right date. So February, the 4th of February, there is one.
Okay.
Yes, exactly that one.
Yes, this is a course coming up and very soon. And it's a course teaching you how to deal with the mind at a deep level. It's very comprehensive training of in a process called analytical hypnotherapy. Transforming therapy, the type of therapy that Gil Boyne specialized in and developed, and it's become the most influential form of deep hypnotherapy in the second half of the 20th century. This is what you start learning, in addition to learning how to be a very good programmer of the subconscious, the rules and techniques for developing great suggestion scripts. That's part of this as well. We teach some of that in an earlier course, but we go into more depth in this course. But this is where you learn how to get into the mind, how to find the deeper roots. You learn your consultation skills and covering skills. You learn so many things, how to deal with the subconscious and begin to reprogram deeply held scripts. So it's a wonderful training for people who want to work with hypnotherapy in a very deep and fulfilling way. for their own practice and helping clients in a very deep way.
And just quickly about that course. I know in March you've got your first course of the series, so to speak, and the clinical hypnotherapy course is a little bit more advanced. It's a very in-depth course that covers. Let's say I'm a very keen, interested person in hypnotherapy. I've recently found out about you and your courses, and I don't want to wait for the March one. I'm happy to take the March one in March, but I already want to start ASAP. Is there anything you can recommend me to read, to contact you about before joining that? Any kind of recommendations, anything to help a person that is interested and they just want to jump into the deep water? Any prerequisites or suggestion to make the journey a little bit easier, because your courses are very intense and very knowledgeable, and there's a lot to take on. So if you can cover that, that'd be great.
Yes, well, each of our courses covers a great deal of information. The one in March, of course, starts you at the beginning, but it's more than a beginner's or foundation course. It teaches you so much how to understand the subconscious, begin to tap into and use its power. Now, for a person who's not coming on a course or would like to get ready for that course or get ready for the clinical hypnotherapy course, I highly recommend this book. I have several, maybe 25 or more books on self-hypnosis alone, and this is by far, in my opinion, the best of them, because it's the work of Gil Boyne, whose self-hypnosis classes were the most popular self-hypnosis classes ever on the planet. And his training course in self-hypnosis, which we do have as well available, but this book is a summary. They're all available from us because we're the publishers of his work. We are Westwood Publishing, the publishing company he set up. And this book takes you through the process of understanding how to tap into your subconscious and use it for your benefit. And that's one of the ways you become a very good therapist, is to understand and use your subconscious power, because that's what you need to work with the subconscious power of the client who's sitting in front of you. So learn from that book. There are other books, there's other information we give you. If you want to jump in and do the course in February, contact us and we will tell you what you need to get ready. We'll give you some extra preparation so that you're very much able to join that course and get the fullest possible benefit from it.
Perfect. Thank you so much. That's great. We are within the time frame. Thank you again for talking to us, and we look forward to talk to you again next week. Thanks again, John.
Thank you.